The aim of this video is to discuss how to use the Mini Mouthcare Matters assessment and recording tool. Maintaining a clean and comfortable mouth is important for eating, communicating, and for overall health. All patients should have a mouthcare assessment on admission and weekly thereafter. If there's a change in medical status, remember to reassess the patient's mouth. The purpose of the mouthcare assessment tool is to record each patient's baseline oral health, help identify if the patient is at risk of developing any oral problems, cover who is responsible for mouthcare during the hospital stay, and highlight when to seek advice from the medical or dental team. Members of staff don't need to be medically trained to undertake a mouthcare assessment. Just have a good understanding of a healthy and non-healthy mouth. A pair of disposable gloves and a good light source, such as a pen torch, is all that are needed to complete the assessment. Patients' oral health can be categorized as low, medium, or high risk based upon several factors, including a visual oral assessment. Lift the lip to ensure that all parts of the mouth are assessed. Look at the teeth and oral hygiene, lips and tongue, both above and below, cheeks and gums. Make a note of patient cooperation. This will help to build up a picture of how much assistance a patient will require during their stay. A low-risk patient is usually identified as being independent or requiring minimal assistance with mouth care. Medium-risk patients may need assistance with mouth care and may be experiencing early problems with their mouth, such as a dry mouth, but no pain. If required, these patients should be advised to visit their dentist on discharge. All patients that are identified as high risk should be referred to the medical team or dentist if there's a referral pathway in place. Once the mouthcare assessment is completed, you'll be able to identify if the patient requires additional support or further onward referral. The elephant mascot can be placed near the patient's bedside to act as a prompt to remind staff about mouth care. The single elephant means the patient can independently look after their mouth. The double elephant means they need assistance with mouth care from ward staff or family. The mouth care assessment tool includes a section for recording all daily mouth care given. This should be completed by whoever delivered the care that session. The patient should also be encouraged to complete this section themselves if able to do so. The mouthcare assessment tool also highlights top tips that can be explained to parents and carers and that are applicable for all of the family. Remember to encourage families to 1. Visit the dentist regularly, ideally before the age of 1. It's free for children under 18 or under 19 and in full-time education. The dentist is also free for pregnant women or those that have had a baby in the last 12 months. 2. Use an age-appropriate fluoride toothpaste, and the correct quantity too. Unless otherwise directed from your dentist, children aged 0 to 3 should use a fluoride toothpaste containing no less than 1,000 ppm, that's parts per million, fluoride. Use only a smear of toothpaste. Occasionally, some high-risk 0 to 3-year-olds will be asked to be on 1,350 ppm fluoride plus from birth. Children aged 3 to 6 should use a fluoride toothpaste containing more than 1,000 ppm fluoride. Use only a pea-size amount. Children aged 7 plus use fluoride toothpaste containing 1,350 to 1,500 ppm fluoride. This information has been taken from the Delivering Better Oral Health Toolkit. 3. Use a small-headed toothbrush and brush in a circular motion, ensuring that the gum line is also cleaned. Brush twice daily, last thing at night and any other time of the day for at least 2 minutes. Spit and do not rinse after brushing. 4. Children need to be helped or supervised by an adult when brushing until at least 7 years of age. 5. Be sugar smart. Too much sugary food and drink can lead to tooth decay. Limit sweets to mealtimes. Choose healthier options like fruit, vegetables, water and milk in between meals. Remember to put the mouth back in the body by lifting the lip and make every contact count.